With new medical advances, the field of cardiovascular medicine is continually changing.
On this week's Health Talk, we'll discuss what's new when it comes to cardiovascular services.
So stay tuned, we're coming up next. Hello, I'm Dr. Eric Baser. Today we're going to talk about cardiovascular medicine with Ann Bartolone. She's Director of Cardiovascular Clinical Operations at Norwalk Hospital. And we have a special treat. Joining us back on the set is my co-host, Dr. Andrea Peterson. She took a brief hiatus, but now will be my permanent co-host. So Andrea, welcome back to Health Talk.
Thank you so much, Eric. It's really great to be back. I appreciate
and Ann,
it.
welcome to Health Talk. It's great to have you back too.
Thank you very
Welcome. So Ann, we were talking a little bit before the show about the fact that there have been so many advances in cardiac care, yet cardiovascular disease remains a really significant problem, doesn't it?
It certainly does. We have not completely eliminated the beast. It still exists. We try to focus our attention now on prevention. It's a very big key point to heart disease. Early detection of heart disease symptoms and early intervention into chest pain and heart attack symptoms.
Now, prevention has changed a lot. I shouldn't say that we've known a long time how to prevent heart disease, but I think the number of people participating in appropriate preventive action has increased. So what are the mainstay of not getting heart disease or preventing heart disease?
Probably all the things your mother taught you. Exercise, eat in moderation, be careful of the foods that you eat. Just because the packaging says that it's good for you doesn't mean that it's necessarily good for you. I think people are much more aware of the quality of the food that they eat, the types of food that they eat, the types of exercise that they get. We've had a lot of medical advances medication-wise with statins. We have many patients that are on statins now, which help to control the development of heart disease. People are very mindful now of their blood pressures too. Blood pressure, hypertension is a very important key into heart disease. Stress reduction, the things to help us to relax and to make our bodies more comfortable. So really it's about eating well, moving well, keeping a good attitude, and taking good care of yourself.
And don't smoke.
And don't smoke.
And that's had a major impact. Just the cessation of smoking, I think, has really changed the pace of cardiovascular disease onset. But let me ask you, there's been I've certainly heard on the news a lot of stuff about saturated fats, unsaturated fats. Some fats are good fats, they're not good fats. Where does all that stand now?
There is a lot of research on the fats, the saturated, unsaturated fats, our cholesterols, our HDLs, LDLs. There's a lot of numbers and letters that get thrown around. It can be fairly confusing when people start talking about high density lipoproteins and low density lipoproteins. There's a lot of good research out there. There's a lot of good information out there, not just on websites. We encourage people to talk to a nutritionist. We have a wonderful nutritionist who works with us with our cardiac rehab program at Norwalk Hospital, who can really put it into everyday terms about reading labels and looking at fats. And what we have found is very nice with society today, or with our industry today, is that almost everything that you buy and everything you eat has a label on it. It tells you, so it's very easy to scan and see what the fats are, the sodium levels, how much fiber is in a piece of whatever it is that you're eating, anything that's on the package, and you can make better choices based on what you read.
Learning to read labels is really important.
It also seems to me that sort of the simplest words, just everything in moderation. You don't want to be in an entirely heavy meat with fat diet. You don't necessarily, you can eat eggs, but you don't want to eat 25 eggs a day. Keeping your calorie count down, keeping your weight controlled, exercising well, and then some of the choices of fats become a minor twitch or a minor thing because you're controlling your overall diet.
Right.
We should mention, you mentioned statins as a class of medication, and many people know that they may be taking them or they were recommended by their doctors to help control cholesterol and lipids, but they have additional effects that are particularly good for preventing and treating cardiovascular disease, don't they?
Yes, they do. And what's key with any medication that your physician puts you on is that you should take it. You should take it as directed. It's not as with the statins or blood pressure medication. It's not something that you just take when you feel, until you feel well. They have to be taken as directed. And statins don't work alone. Statins work with a healthy diet and with foods in moderation and with a good amount of exercise as well.
And we always like to encourage people on this show, if you have questions about your medication, you're not sure why your doctor prescribed that, please ask. Please do ask. You don't just stop it on your own, but find out exactly why that was recommended for you.
And I think it's also important to realize that for a large group of people, even if they eat perfectly, their genetics are such that they're going to have problems with cholesterol. I think for a while we put out there the misinformation, not deliberately, but put out there the idea that if you ate properly and exercised, your lipids, your cholesterol would always be under control. And I think we've understood now that it's really a minority of people who can so beautifully control their cholesterol that way. And so if you have genetically high predisposition to cholesterol, I think that the statins have almost been miraculous in terms of preventing cardiovascular. In my own family, my dad had a heart attack at 55. He had another one in his early 60s. I'm now well past both of the milestones with no cardiac disease that I know of at all. So it's really, and I'm on a statin. So I think that they are really fabulous drugs and should not hesitate to take them. The side effects tend to be relatively minor. People talk about muscle cramping, but I think as a whole, they really are a real breakthrough in cardiovascular disease, and that plus stopping smoking has so much of an influence on reducing cardiac disease in our country.
And to your point, Dr. Mazur, when you speak about the fact that every medication that you take has a potential for a side effect, and if you're not feeling well on the medication that your physician puts you on, a high blood pressure medication or a statin, you should talk to them about it because there's such a big variety now.
There's so many alternatives.
Right.
You can find something that generally find something that works for you.
Absolutely.
And both with blood pressure, and statins, once your numbers are good, that doesn't mean you stop the medicines. I think
That's
so many
absolutely
people say they've treated my blood pressure. I'm all better now. I'm going to stop the blood pressure medicine. Don't stop them. You really need to take them continually because it's really that's changing your metabolism that's allowing you to be more healthy.
Absolutely. Yes. Maybe we can talk a little bit, though, about what people might experience if they are developing heart disease and what kinds of signs and symptoms they should be watching for.
Well, many people as they get older, or even in our younger population, may start to feel that they're having some chest pain. The classic would be your chest pain, arm pain, back pain, shortness of breath. Inability to do the things that you were doing before is usually how you start to see a subtle onset of heart disease. If you think about it, the heart is a muscle and its main function is to pump, and it's to pump blood. And if anything interferes with that ability to pump blood, you're going to have a downstream effect. You're just not going to have as much energy. You may not be able to climb a flight of stairs. In your exercise routine, you may find yourself more winded than before. And some of it's just transient. Some of it's just you're not having a good day, you didn't get so much sleep. But when you're starting to feel like there's something wrong, that you're not in the same kind of health that you were before, you should definitely see your doctor. We really try to focus a lot of our attention now on for people to understand the early heart attack symptoms and early heart attack intervention so that we can prevent what would be an angina type of problem, which is angina is when the heart muscle does not get enough oxygen, to go from that to become a heart attack. So we really want to prevent that. We really want to be able to intervene. And part of that intervention is really identifying that you are having some kind of heart symptoms.
And the symptoms are not typically sharp pain in the chest. In fact, I remember in medical school we were always taught to ask the question about discomfort because it could be a sense of pressure, it could be a sense of shortness of breath only with very modest exercise. So those could be very important warning signs, and just because it's not painful, it doesn't mean that it's not angina, that it's not a problem with the heart not getting enough muscle.
Right.
The heart muscle not getting enough oxygen. And women are different too.
Yes.
So let's talk a little bit about that because women often don't have the classic anginal symptoms.
Right, so if you look up chest pain or heart attacks go into Google and the internet, and are looking at that, they'll talk about the classic presentation of somebody who's having a heart attack. Would be your crushing chest pain. People describe an elephant sitting on their chest, inability to breathe, the pain radiating to the arm, to the left arm, going to the back, maybe into the jaw and into the neck.
Sometimes with nausea or feeling very sweaty.
Right, very sweaty, and then sometimes just feeling like there's something terribly wrong here. And those are the easy ones to identify, because those are the patients, those are the people that tend to call 911 and tend to go right to the hospital because they know something is terribly wrong. And then there's that other area with people that have some indigestion and they've got a little pain between their shoulder blades, or my jaw hurts me, or it goes to my arm. And women, for them, chest pain is not usually the first presentation. It usually is very associated with nausea, vomiting, indigestion. And women, because we tend to put ourselves second and ignore a lot of the symptoms that we have, by the time we do present and somebody identifies it with as a heart attack, we've lost a lot of time in terms of intervening.
So nausea, vomiting, heartburn are very common symptoms, and we all get those. So how should a woman or a man assess whether these are bad enough to go immediately to the emergency room, or is this just heartburn?
I think everybody has lived in the same skin for their whole life, and you know when something isn't right. You may have had heartburn before when you overate or had some indigestion because of that. But I think that you know that something is different about this type of pain. We would rather that you present, go to your doctor, go to the emergency room, and be wrong about whether this pain was really from your heart, than to not show up at all and assume that it is from your heart, that it's not from your heart, that it's your stomach.
So really listen to your body and what it's trying to tell you is what you're saying. And if you have something that is not going away when you might have expected it to go away, it's not starting to get better, or maybe it's getting worse and worse, those may be other indications to say, there's something not quite right here, let me get it checked out.
And classic heartburn should go away almost immediately when you take an antacid, whereas heart pain will not. So if you take some Maalox or Pepto-Bismol or something, it goes away completely and you feel absolutely fine. You can be relatively assured that it's not heart pain. But as you said, if there's any question, now earlier is always better than later, and that's changed a little bit. I mean, in the past, we used to just watch heart attacks happen, and I certainly lived through that era. But we don't do that anymore, do we?
No. When I first started in nursing school and nursing, that was how we handled heart attacks. We let them run their course. We watched them. We were supportive in terms of irregular heartbeats and pain control, but there really wasn't a whole lot that we had to offer patients who are having a heart attack, except really supportive care. And now it's all about early intervention. Our patients come to Norwalk Hospital. They come to our emergency room. Sometimes it's our inpatients who present with chest pain, and the first thing that we do is get a 12-lead EKG. It's a painless test that's done by putting leads on the chest that assess the electrical patterns of the heart. And when we see damage to the heart, which shows up on that electrical EKG, we activate our STEMI team, and STEMI stands for ST elevation MI, which is a technical term for somebody who's having a heart attack. And within less than 30 minutes, we're going to get you on our cath lab table, and we're going to start to open up the blood vessel that is closed off, because that's what's causing your heart attack. You've got a blood vessel which isn't supplying oxygen to the heart muscle itself, and the faster we can get that open, the less damage you'll have to the heart muscle.
It's amazing. It's just simply a plumbing problem. Something as profound as your life is really a plumbing problem in the heart.
Yes, and what we do when we get our patients into the cath lab is we first identify the blood vessel that is giving us the problem. A balloon is inserted. These are very small catheters that we use. They're about the size of a strand of spaghetti. And on the end of them is a deflated balloon. It gets inserted into the blood vessel and opened up, and it pushes the clot against the walls, and then we reinforce that opening with a stent, which is like a little wire cage that just keeps that blood vessel open.
And I think what we'll do is that we've run out of time for this segment, but it's truly amazing, because you can take someone in the middle of a massive heart attack and literally make it go away. And the pain goes away,
Yes.
and the patients are suddenly, the heart beats normally.
Yes.
So I want to talk a little bit about that, as well as the rehabilitation and some of the other things that happen after someone has heart disease in the next segment. We need to take a break, and then we'll be back to talk more about cardiovascular operations or cardiovascular illnesses at Norwalk Hospital and the Western Connecticut Health Network. Hi, we're back with Ann Bartolone, the cardiovascular nurse. We were talking about the magic of PAMI, the opening of the blood vessel when a patient is having a heart attack. So when you open up the blood vessel successfully, what happens?
The oxygen is then restored to that blood, to that area of the heart where it was not getting oxygen before. And by restoring the blood flow, the heart can go back to pretty normal function. There may still be a slight amount of damage done to the heart because there was, for a time being, it did not receive the blood flow that it needed, but it does incredibly limit the size of the heart attack. Now, the heart is a pump, so the better the pump works, the better the rest of your body works because it's responsible for all those other functions. The supportive care now has to do with really, at that point, once we have opened the blood vessel and restored the blood flow after letting the patient rest, is to get them involved in a cardiac rehab program and start to help their heart to get stronger. Just like any other injury that you may have to your leg or any other muscle in your body, we want to quickly restore it to its previous function.
And maybe you could tell us a little bit about what cardiac rehab really involves.
Well, our cardiac rehab program that we have at Norwalk Hospital, and we have one at Danbury Hospital as well, is focused on health and wellness. It's very supportive. It's very focused on exercising a patient in a monitored setting, teaching them about their diet, about exercise, about their medications, about stress reduction, meditation. There are so many modules that we work with in our cardiac rehab program. Really restoring patients' confidence. Many of them are very fragile after they've had a heart attack and very concerned about getting back to their regular activity.
I can certainly understand that. The idea of you've got an injured heart and you've had a heart attack, again, it may be a bit attenuated because you had the blood vessel open, but you've still had some damage to that heart. A certain fear of exercise, of sex, of the things that normally are part of your life that you suddenly are afraid that you might precipitate another heart attack. That's why you monitor patients, isn't it? To both reassure them, but also to make sure they don't have any abnormal rhythms as that heart begins to work more aggressively.
And it's a supervised program, so it's supervised by our nurse practitioner and by our exercise physiologists who are very well trained in rehabilitation and the function of all the muscles. And it's a very individualized program. So if you are a person who came and was relatively active and healthy prior to your heart attack, and we also see patients who have had heart surgery. So based on your precondition, we'll determine what your exercise is going to look like. So if I'm on a treadmill next to you, our programs are going to be totally different based on where we stand, what our injury was, and how we're progressing. So it's very monitored. Patients are with us for about 12 weeks, 12 to 16 weeks. We also have the option of having them go to an extended recovery, extended supervision program after they're done with their acute program.
Is that indefinite, that extended recovery program?
They can sign up and continue to go in a supervised setting. Some of our patients will transition to a regular gym afterwards, but many of them like just like the care and attention that they receive from the team that saw them when they were just starting out.
Well, it sounds very much like whole person care because, of course, the heart attack doesn't happen just to the heart, it happens to the whole person and can affect families as well in a real way. Do you see people able to make real changes in their lifestyle having gone through these programs?
Absolutely. It's very amazing to see having the program at Norwalk Hospital. We have our cardiac cath lab, which is adjacent to our cardiac rehab center. So many times we see patients that we have done interventions on, and then we see them come down the hall a few weeks later for cardiac rehab. We have patients that are totally deconditioned, who have never exercised a day in their life, have horrible diets. They don't take care of themselves. They're smokers. They've not been following their physician's directions. And to see the transformation is absolutely fabulous. And by the end of their program, they have nothing but complimentary things to say about how far they've come.
And it's really meaningful, right? Because patients themselves can decrease their risk of having another heart attack if they do all this work and really make changes to their lifestyle.
And you think about that as that person makes that changes, their husband or wife is making changes. Their family members are starting to make changes because now that's their history. If dad had a heart attack, that means that you now have a family history of heart disease. And so it really is a wake-up call for many family members to say it's time for me to start taking care of myself. So it has a big effect on their whole system, as well as their friends, family. Everybody starts to get a little bit more awakened to it.
It's a shame that so often it takes a real event for people to accept their own mortality and respond to that and live a healthy lifestyle. It really is an awakening. It's to suddenly realize that you're fragile, that these things can happen to you.
Right. Right, and that's, I think, the emotional part of it. We do a lot of emotional support for our patients. The different programs that we have, the nutrition program, the stress reduction program, meditation, medication review, really help to support them and make them feel that they're not just a patient, that they don't just have a disease, and that the things that we want to incorporate can really incorporate into their lifestyle and everybody else's lifestyle.
I'm curious, what do you do for the stress reduction part?
We have a class on stress reduction. We teach our patients how to identify their stress triggers.
How to yell at the boss?
and how their body actually reacts to stress, and why stress is so harmful to the body. And then offer methods for them to start to work on their stress reduction. Everybody's method's going to be different. For some people, you will encourage them to do yoga. For some people, it's a walk around the block or listening to music. Everybody is very individualized, but we start to give them techniques and methods that they can use to reduce their stress.
And I hear a lot about mindfulness in this era as a way of managing stress. Is that part of what you mentioned yoga? I know that's sort of a component of that. Do you talk about that with your patients?
Yes, when we do our classes on stress reduction and on meditation, we really focus on the fact that you're here, this is where you are right now. Maybe there's some changes you want to make in your life. It's going to be staged. It's not going to be something that happens overnight. We also don't want to stress people about the fact that
to be stressed about reducing your stress.
Right, but we find that we do include families in our meetings, and our educational offerings are all include everybody, so that everybody's involved in the care of their patient.
We have a couple minutes left in the show, and I did want to give you a chance to talk about some of the community outreach that is going on as well, because we've talked a lot about what happens to the individual patient and a little bit about the family, but educating the community and helping people be healthier out in the community is really important as well, isn't it?
Yes, it is, and I'm very proud to say that Norwalk Hospital and Danbury Hospital, we are both accredited as chest pain centers, and that puts us on a national level, looking at all the standards of how we take care of patients with heart disease, how we identify early heart attacks, how our EMS responds, what kind of services we provide within our hospital to deal with patients who have chest pain and heart disease. But the big focus is on community and outreach for early heart attack care and early heart attack intervention, teaching our communities about about heart disease, their symptoms, and one of the big focuses has been on the use of AEDs. Those are
tell people what that is.
Automatic external defibrillators, and you'll see them in the community. They're in airports, they're in schools now, but people have to really understand how to use them. Norwalk Hospital has partnered with several organizations, as well as Danbury Hospital, to have community programs called, you may have seen the flyers around, called hands-only CPR classes. We've had them at the beach this summer. We had them on the days when they had the concerts in Norwalk. And it was a short educational program about the symptoms of heart disease and what to do if somebody suddenly collapses and how to use an AED. It's fine to say, you know, oh, if somebody collapses, go use the AED, but if you've never opened it up to see how it performs and how to turn on the buttons and what it feels like and what it sounds like, you'd be very hesitant about going to intervene if somebody did collapse. So we're
very blessed in this community because one of our trustees at Norwalk Hospital and one of our neighbors in Westport actually saved a young man in Westport, I think playing soccer or something like that, with an AED he happened to have in his trunk. And he has now donated, and the hospital has matched it and just helped distribute a number of AEDs around our community. So this is really part of I think the hospital, the health providers trying to improve the health of our communities.
Absolutely,
yes.
So important. Great.
And CPR has always, we have many people that are afraid to intervene or with CPR because of the mouth-to-mouth part seems to be the piece that people are most hesitant about.
And then we're going to have to stop it at that because we've run out of time. But I think we've done shows on CPR. We should do another one to really talk about that. So I want to thank Ann, and when we come back, we'll have today's health question.
Right now, let's take a look at some of the upcoming events sponsored by Western Connecticut Health Network.
Hi, this week's viewer question is, are heart attacks hereditary?
Well, we're very lucky to have an expert on set here to help answer that. So, Ann, are heart attacks hereditary?
Yes and no. I think that
a definitive answer.
We are all shaped by our genetics and our family history. But I think that if you have a family member who has heart disease, it makes you more at risk of developing heart disease. But now with all the different treatments and early interventions that we have and medications and awareness of heart disease, you can maybe even change your genetics. Just because your dad had a heart attack does not mean that you will have it. But that means that you have to be very proactive about your health, about exercise and fitness and your cholesterol and your lipid levels, exercising and eating right, and hopefully you will be able to reverse that. You can't change your heredity. You can't change the fact that you're male versus female or your age. As we age, there's also a factor to heart disease. So yes and no, it is hereditary, but I think that we can definitely help to shape what our story is going to be.
It's putting the odds in your favor by doing those right things.
You can stop smoking,
go ahead.
manage your blood glucoses if you have diabetes, make sure you take your blood pressure medications as you mentioned earlier.
And your cholesterol, exercise, the 150 minutes a week or whatever the current recommendation is, but aerobic exercise. And then the other, I think, wonderful thing is to recognize that if we have a heart attack, if you have heart disease, the treatments today are really remarkably better than they were 25 years ago. People are surviving heart attacks with minimal or no cardiac damage, which is
and our
sort of
takeaway
amazing.
message is to call 911 if you have heart disease symptoms, because the earlier we can get to you, an ambulance is a little hospital on wheels, and the earlier we can get to you and start taking care of you, the less damage you'll have.
And that's a perfect message to end on. Thank you, Ann. Thank you so much for
You're
coming
welcome.
on the show today. If you at home have a question you'd like to ask Andrea and me on Health Talk, please contact us at healthtalk@norwalkhealth.org. Want to thank our guest today.
Our guest today, Ann Bartolone, for coming on the show.
We'll see you next week on Health Talk. Thanks, Ann.